was actually determined by the clinical trials. So for instance, for Pfizer, Pfizer looked at what they thought was how efficacious just one dose of vaccine was, or from kind of their Bayesian models of what they called, and that's just a fancy term for saying their projection models of how immune someone can be after one vaccine or two vaccines. It made the decision that two vaccines was going to be significantly more efficacious than one. We do know in certain vaccines that we have, and I'm not talking about COVID, that we get boosters every so often. So people who have had tetanus or diphtheria vaccines, we know that we booster every 10 years generally for that. So we don't know if there will be a booster component to this vaccine, if this will end up being an annual vaccine, or if this will be something that's, you get the initial 2 in this case, and then you're done for a lifetime. That actually is decided by the state of Delaware in the Division of Public Health. They have a team along with some committees, including the COVID-19 Vaccine Committee that Beebe is a part of. But the actual allocation of how many vaccines we receive is decided upon by the Division of Public Health in the state of Delaware. And that also goes to a higher level. It also depends on how much is dispersed from the federal government to the state of Delaware. So their decisions are based even on higher decisions from my understanding.
You got today, you expect the next?
Yes, so we know that we received 630 vaccines today. What that is also important, because we have spoken about 2 doses for this, we are guaranteed 630 vaccines in 3 weeks from now as well. So we do not have to cut that 630 into 315 to save half of that for next time. We have tentative plans on receiving more vaccine next week, and those final numbers are still coming. I haven't heard the final decision, but it should be, from my understanding, at least the same amount, if not more, than what we received today.
What does it mean for Beebe to have this vaccine?
Huge, right? I mean, huge. Here we are since since March, when we identified the first cases of COVID-19 in Sussex County. I mean, where we've come from March of 2020, which it's hard to believe it's December already of 2020, we can now offer, in addition to what we've done this entire time that you heard Cynthia talk about and others, with making sure that we've been able to secure PPE through alternative resources, making sure that we are doing what we can from hand washing and sanitizing and cleaning that George talked about. This is an extra layer of protection that now we can provide. I mean, all our healthcare workers, starting with our frontline healthcare workers. So it's yeah, so we have been fortunate enough to be able to basically to obtain, and which we've had, ultra cold storage. I think that's one of the buzz terms that everyone has talked about. We have freezers that are -60 to -80 degrees Celsius, and I repeat that, Celsius. So we have had the ability for ultra cold storage. So we have dedicated a freezer for our vaccine storage. So we have been fortunate enough to be able to do that. Ideally, if enough people gain immunity to COVID-19, then this is really when the pandemic starts to take a shift and become less virulent, and becomes while it may not go away anytime soon, it becomes something that is less of every day. You wake up every day and one of the first things you think about is COVID. So we're hoping that it gets us back to, quote, normal, if there ever really is a normal. So,
will you get a vaccine today?
I will get a vaccine, if not today. So we have disbursement of vaccines, and those vials that you guys saw, there's 5 doses in each vial. So we do have to make sure that we have 5 people ready to go for a vaccine, just because once that vaccine is basically mixed or diluted, and once we enter for that first vaccine, we only have 6 hours to use that vial. So we need to group people together, which we have plans to do, to make sure that we don't waste a single dose of the vaccine.